Welcome back. I want you to imagine a sound. It's a high-pitched wail, a siren, in London, or Tokyo, or Toronto. When you hear that siren, you think, oh no, someone is hurt. I hope they get help. But in America, when you hear that siren, you have a different thought. You think, oh no, someone is about to lose their house. We live in the only wealthy nation on earth where a broken leg can lead to a broken life. We are told we have the best healthcare in the world. And that is technically true. If you are a billionaire or a senator, the technology is miraculous. But for the average American, the healthcare system is not a safety net. It is a minefield. You can do everything right. You can go to college, get a good job, pay your taxes, and pay $500 a month for health insurance. And then, one day, your appendix bursts. You wake up after surgery, groggy and in pain, and a week later, you check your mailbox. You find a bill for $42,000. Why? Because the anesthesiologist who put you to sleep was out of network, even though he was standing in an in-network hospital room. This is the uniquely American phenomenon of medical bankruptcy. It is the #1 cause of personal bankruptcy in the United States. Not gambling, not bad business deals, not spending too much on avocado toast. It is getting cancer. Today, we are going to dissect the scam. We will look at the confusing language of deductibles and copays designed to make you give up. We will look at why a single aspirin pill in a hospital costs $30. And we will explain why, in the richest country in history, people are taking Uber to the ER while having a heart attack because they are more afraid of the ambulance bill than they are of death. Let's start with the biggest lie. I have insurance, so I'm safe. In 2026, having health insurance doesn't mean your healthcare is free. It just means you get a discount on your bankruptcy. The system is built on a vocabulary designed to confuse you. First, you have the premium nets, the monthly subscription fee. You pay $400 or $500 a month just to be a member of the club. Then you have the deductible. This is the devil's invention. A deductible is the amount you have to pay out of your own pocket before the insurance company pays a single dime. For many affordable plans, the deductible is $5,000 or $7,000. So let's do the math. You pay $6,000 a year in premiums. Then you get sick. You have to pay another $6,000 in deductibles before the insurance kicks in. You are now $12,000 in the hole, and the insurance company hasn't spent a dollar yet. They call this consumer-driven healthcare. They say it gives you skin in the game. But when you are bleeding out on a gurney, you don't want skin in the game. You want a doctor. And even when they do pay, they have co-pays and co-insurance. We will pay 80%, you pay 20%. Well, 20% of a heart surgery is still a new Honda Civic. We have created a class of people called the underinsured. These are people who have insurance cards in their wallets, but they are terrified to use them because they can't afford the deductible. It's like having a membership to a gym where you have to pay $50 every time you touch a dumbbell. But the deductible is just the JAP. The milkout punch is the surprise bill. This is the most Kafkaesque part of the American system. Here is the scenario. You need surgery. You are a responsible adult. You call your insurance company to ask, is St. Mary's Hospital in network? They say yes. You ask, is Dr. Smith, the surgeon, in network? They say yes. You think you are safe. You go in. You get the surgery. 2 weeks later, you get a bill for $25,000 from a group called North American Anesthesia Partners, LLC. You panic. You call them. Oh, they say, Dr. Smith is in your network. But the guy who monitored your breathing, he's an independent contractor. He doesn't work for the hospital, and he doesn't take your insurance. This is called balance billing. You went to the right restaurant. You ordered from the menu. But the waiter who brought the food works for a rival company and charges $500 for the service. It is a trap. You are unconscious on a table. You cannot ask the anesthesiologist to see his credentials. You cannot show around. You are a captive audience, and they are extracting maximum value from your body. The government passed the No Surprises Act to try and stop this, but the private equity firms that own these doctor groups are fighting it with armies of lawyers, finding every loophole to keep the invoices flowing. Now, let's talk about the ride to the hospital. In any other country, an ambulance is a public service. Like the fire department. If your house is on fire, the firemen don't show up and ask for your credit card before they turn on the hose. But in America, an ambulance is often a private business on wheels. Private equity firms have quietly bought up ambulance services all over the country. They realized that when you are having a stroke, you are price inelastic. That's economists speak for you will pay anything to not die. So they charge $2,500, $3,000, sometimes $5,000 for a 15-minute ride. They charge you per mile. They charge you for the oxygen. They charge you for the bandages. This has led to a dystopian trend, the Uberlance. People with broken arms, people in active labor, people with chest pains are calling Uber or Lyft to take them to the emergency room. Imagine being an Uber driver. You pull up to a house, and a guy gets in clutching his chest, turning purple. You aren't a paramedic. You have a Toyota Camry and a bottle of water. But that passenger is risking his life because he knows that if he calls 911, his financial life is over. We have monetized desperation. So you arrive at the hospital. How do they decide what to charge you? They use a secret list called the Chargemaster. This list is one of the most absurd documents in the modern world. The prices on it are made up. They have no relation to reality. On a Chargemaster, a single Tylenol pill might be listed at $35. You can buy a bottle of 100 Tylenols at CVS for $8. That is a markup of 40,000%. An IV bag of saline salt water, $600. A sterile marker to mark the incision site, $150. Why? Because the hospital expects the insurance company to negotiate. The hospital says, this Tylenol is $35. The insurance company says, that's crazy. We will pay you $12. The hospital says, deal. But if you don't have insurance, or if you are out of network, you get the bill for $35. You are charged the rack rate, the highest possible price. And good luck trying to find out the price before you get care. Try calling a hospital and asking how much is an MRI. They will laugh at you. They will transfer you to 5 different departments. Nobody knows you don't know the price until weeks later when the bill arrives. Imagine walking into a grocery store where there are no price tags. You fill your cart, you go home, and a month later they send you a bill for $800 for a gallon of milk. That is American healthcare. But wait, you say, aren't most hospitals nonprofits? Like charities? Legally, yes. In reality, no. Many nonprofit hospital systems sit on billions of dollars in cash reserves. They pay their CEOs $5, $10, sometimes $20 million a year. And they are ruthless debt collectors. There have been scandals where nonprofit hospitals sued thousands of low-income patients. They garnished the wages of waitresses. They put liens on the homes of janitors, all because they couldn't pay the inflated Chargemaster prices. These hospitals get massive tax breaks because they are supposed to provide community benefit. But instead of helping the poor, they often bankrupt them to protect their bottom line. They are hedge funds that occasionally perform heart surgery. So, what is the result of all this? The result is fear. Americans live with a low-level background radiation of anxiety. We know that we are one bad slip on the ice, one mysterious lump, or one car accident away from ruin. We stay in jobs we hate because we need the insurance. This is called job lock. We skip preventative care. We ignore that pain in our knee until it's too late. And when we finally do go to the doctor, our blood pressure is higher not because of the illness, but because we are worried about the clipboard the receptionist is holding. The defenders of the system say, but we have freedom of choice. But what is the value of choosing your doctor if you can't afford to see him? What is the value of innovation if the only thing being innovative is new ways to deny your claim? Until we treat healthcare as a human right and not a luxury product, the American dream will continue to have a very expensive deductible. Thanks for watching. Let me know in the comments. Have you ever received a surprise bill? Or have you ever taken an Uber to the ER? I want to read your horror stories. And please like and subscribe, because my health insurance doesn't cover therapy, and reading these bills is driving me crazy. See you in the next one.